Good afternoon, everybody. I am standing in the Backus Hospital warehouse, about 5 miles door to door from Backus Hospital. And this is where our incredible team in supply chain store the supplies that we need. And many of you have asked questions around PPE. You know, through the pandemic and all through COVID-19, we have been so clear about focusing on your safety, our safety, so that we keep you safe and our patients safe and your family safe. But as we know, there's no end in sight for the pandemic. So I thought it would be really helpful to take a walk through the warehouse and show you what we have in storage for our personal protective equipment. I want to invite in Matt Kaufman, our Vice President of Operations, and Tim Allard, who is our East Region Supply Chain. I put on my mask so that I'm following our rules. So we're here today. So I'm going to ask Tim to talk to us for a minute about how he has managed to collect and acquire so much PPE. And then Matt and Tim and I are going to walk you through the warehouse so we can show you exactly what we have on hand to keep you all safe. So Tim.
So we work every day for the as a system to acquire as much PPE as we can. We meet at 1 o'clock every day. We have a list from our distributors and we place orders. It could be anywhere from a one box to several pallets.
So we have been, since the pandemic began, and at the beginning when we didn't know how long it would last, how many patients we would get, Tim has done an amazing job of never giving up on acquiring the PPE that we know we need. And that's being done at a system level. So this warehouse that you're going to see in just a minute is only one of a number of warehouses within Hartford Healthcare. So just imagine this multiplied 6 times over. So we made a commitment and shared with you that we have not stopped acquiring PPE. Now we're going to show you. Matt, would you?
I think it even goes beyond PPE to other supplies that we would need in the pandemic to keep caring for patients. We look at things like the appropriate wipes, the sani-cloths, even things like toilet paper.
Mm-hmm.
You know, all those supplies that we would have felt the real pinch if we went without. And as you'll see through the tour, we have pallets of these things that Tim and his team have done a great job of being proactive in acquiring when the word on the street or in the community or really in the country is that these things are going to be in short supply. So looking around, I hope that you all feel the same sense of comfort and confidence that we feel when we look around at our supplies.
And the reason it's important for you to all see this is so close to the hospital. This is where we keep our large supplies. So when you see the smaller supplies on your units or in your department, it's really only to keep on hand what we need because we know this backup is waiting here for us and we have access whenever we need it. So why don't we take a little bit of a walk through, and Jeff Evans, our cameraman, videographer extraordinaire, is going to follow us as we walk through the warehouse and show you some of the PPE that we have in supply.
So if you look here, on the upper levels are all of our pandemic supply that we have brought in since the pandemic started. It has all PPE and some other critical supplies. And then this is newly purchased here on the floor. We're waiting to make some room to put it up there.
Okay, so Tim told me a story. There was a rumor that we were going to run short of the blue underpads for patient beds. So Tim immediately went out and ordered so we have a supply because that's Tim's job and that's what he does every day for us.
I think 5 pallets right here of that supply.
Yeah.
But I see lactated ringers, shoe covers, let's see, what else?
Gowns.
Lots of gowns.
On the other side, we have face masks. We have bouffant caps. We have all types of face masks, N95s, procedure masks.
So it's really distributed. Why don't we take a little stroll, Tim, if you don't mind, walking us through.
Sure. Thank you, sir.
Tim, I've got the microphone.
Actually, there's a good shot back here that I saw. Right here we have face shields and newly purchased procedure masks. We have a couple pallets of those. This is our gloves, but an intact back here shows all the N95s we have. This is our main mask. It's the yellow mask that we used for years. But I have a whole wall full of it.
Wow.
So these are additional N95s.
Those are regular yellow procedure masks
Okay.
that we use. All of our N95s are back here on these pallets. Those are the green 1860 masks that most people are fitted for.
I see. So it's the
Oh, our
Yep.
3M
Yep.
masks.
Yep.
So here we have Purell. So all throughout the warehouse are different supplies that we need to keep every staff member safe.
And these are the small Purells that go out to some of the practices. We have much larger pallets with the Purell that you traditionally use for the.
And here are more face masks. Clearly it's coming in so often that they haven't even been put away, these supplies.
We've run out of room.
Run out of room.
Here we have all of gloves that we brought in, gloves and face shields. So if you want to scan this whole area, there's more pallets than you can count right now.
So we have face shields, gloves,
Over here is all face shields and gloves and IVs.
intravenous fluids.
Yep.
So early in the pandemic, we didn't know how many beds we were going to need for our COVID-19 patients, and we couldn't get beds. So we did the best we could do, and we ordered Stryker mattresses. So let's take a walk over here, and you can see that as soon as we identify a need, we are quickly going out with Tim and team to acquire the necessary equipment and supplies.
These are, I think, 47 total mattresses.
I think 49.
49.
49.
So we are going to start to distribute these, but this was during the pandemic of if we needed to make a bed, or we couldn't buy or rent a bed, let's get the best surface that we could for patients.
I know you and I were on the Plainfield ED a week ago, and some of those mattresses are getting thin, so we're going to replace
And certainly anything
some of
that
those
has a
mattresses.
tear, given the infection prevention risk right now, we're proactively
That's great.
changing those out for these.
They're buying 1 million at a time. They don't all come at once, so I don't even know how many of these gloves of that is probably 1/10 of that million that we got. But face masks, we have 1 million. We have 1 million of the black
A million?
masks. 1 million of them.
So we have 1 million masks. So I think what's really important is the purchasing power that Hartford Healthcare brings to our system allows us to tap into that and then identify what we need and have that ready and on hand for our staff.
And if it's not in this building, it's somewhere in the system.
Okay, you heard it from Tim. If it's not in this building, there's a huge warehouse in New Britain that has 600 pallets of PPE.
We talk every day.
Yeah.
We have a call at 10:30. We talk as a supply chain group. We talk every day. If anybody needs anything, we move stuff around the system. It's very fluid.
Very fluid. I think it's need-based. Right?
Yep.
Well,
Yeah,
thank
so
you.
if Hartford needs something, we
The
send
things
them
in
and
this
we have it.
warehouse we've seen are primarily for the east regions.
Correct.
Yeah, Windham. Yeah, primarily Windham and Backus are in this building. Windham has even smaller storage space, so we keep some of their pandemic here too.
My hope is that this gives you all confidence and reassurance that we as a team are constantly acquiring really important safety equipment and supplies for our patients. So Tim, thank you for the great work. Matt, thanks for the great tour. And as always, Jeff, thank you for your videography, wizardry, and Krista stepping in and carrying the mic. Thank you so much. Appreciate it. Have a great day.